Good afternoon, Dr. Loucks. It's a pleasure to meet you today, and congratulations on your trial where you're looking at mindfulness and its role in the regulation of blood pressure in patients with hypertension. It's a great study, certainly very interesting, so thank you so much. Perhaps you could tell us a little bit about your study.
Sure. Yeah, so in the United States, about half of Americans have hypertension, and of them, only about half have it controlled. And so we wondered if perhaps training participants up in mindfulness skills like self-awareness and attention control and emotion regulation, and then applying those skills to the things that we know influence blood pressure, like their relationship with their physical activity, with their diet, with their antihypertensive medication adherence, the relationship with alcohol consumption, if that might actually boost effects to bring blood pressure down. And so what we found after 6 months of follow-up in the participants that were randomized to the mindfulness-based blood pressure reduction program, that they had about a 5.9 millimeter of mercury drop in systolic blood pressure compared to baseline, and it outperformed a control group that was an enhanced usual care control group that it outperformed them by about 4.5 millimeters of mercury. When we looked at the mechanisms of just how it might work, there was evidence to support it potentially working through physical and particularly sedentary activities. So we saw a nice drop in sitting minutes, for example, sedentary activities in participants, and some improvement in physical activity as well. And also some evidence of improvement in adherence to a DASH diet, which is one of the most evidence-based diets to bring blood pressure down. And also saw a nice improvement in mindfulness compared to the control group too. So, a recent systematic review and meta-analysis showed that about a 5 millimeter drop in systolic blood pressure translates into about a 10% reduction in major cardiovascular events like myocardial infarction and stroke. So these findings have some potential to be clinically relevant, particularly if we see the findings replicated by external groups to have some longer follow-up time beyond the 6 months. And maybe a more generalizable population as well. So that's what we're seeing.
Wow, congratulations. I mean, those are pretty impressive numbers for a lifestyle modification type intervention. So there have been so many different approaches to lifestyle changes. Why did you think mindfulness would be more effective or not compared to the other approaches?
Yeah. I think it's a fresh approach. So with mindfulness training, we train participants up in self-awareness. And so say self-awareness of our physical sensations, our emotions, and our thoughts. But when we look at some of the biggest causes of hypertension, like say physical activity, people generally feel better for hours after physical activity. And same with diet. When people eat healthier diets, they often feel better. Even, about half of us, when we eat something sweet, we often get a sugar high and then a sugar crash. And so with mindful awareness, can we just notice that without any judgment, with curiosity, acceptance, and then see what insights arise? And so if insights arise, say around finding physical activities that are a good fit for our body and our environment at this moment in our life, then can we actually take action on it? And another piece of mindfulness training is with attention control, so that when we're meditating, we're placing our mind where we choose to place it, or at least we're training ourselves to do that, whether we're placing our mind on the breath or another object of meditation. The mind wanders, we notice where it went. It's good information, self-awareness, and keep coming back. And so then if we start to have insights around, say, behavior change that we feel would be a benefit for our blood pressure, that training and attention control can actually potentially help us make those shifts so that we actually go and select those particular foods, say at the grocery store, or that we actually engage in that particular physical activity, because we're just getting better at not only the self-awareness and the insights that arise, but then directing our mind where we choose to place it and potentially acting on that. So that's sort of why we thought that mindfulness might integrate in actually with evidence-based medicine and behavior change.
So Dr. Loucks, that's very, very interesting, but I imagine that actually takes a huge amount of effort on the part of the patient. And I would imagine that patients need to buy into and believe in this concept of mindfulness. And is this something that you found patients embraced? Because I imagine some patients might not feed into the whole concept of mindfulness. In other words, do you have to believe in it in order for it to be successful?
Yeah, I mean, I think with mindfulness programs, I prefer like an opt-in approach rather than opt-out, so that when we advertise for the study, we advertise it being, training participants up in mindfulness. The amount of people meditating in the U.S. is like, it tripled between 2012 and 2017, and it's continued to go up. So mindfulness there's a great amount of public interest in this right now. And so we didn't have too much of a problem recruiting the 201 participants to our study, but they knew it was about mindfulness. Yes. And so there was a certain amount of at least being open towards it. Yes. And there's some evidence, particularly in kids, that if they receive mindfulness training, they didn't really want it. It's actually not so good. But the ones that wanted it and appreciated it can be beneficial. So I prefer for folks that it might be a good fit for them to consider it. But there's many paths to bring blood pressure down. And so a mindfulness-based path might be one path that some people might appreciate, but it might not be for everyone.
Okay, that's really important. So where do you think this is leading to in terms of, treating patients with hypertension, getting those numbers down in the US and globally, actually?
Right.
I mean, how do you see this, rolling out?
Yeah, we've done a phase 1 clinical trial now, and then this one that we're reporting on today is a phase 2 clinical trial. So the next step would be like a phase 3, so probably a multi-site trial, longer-term follow-up. I'd like to see not only clinic-based blood pressure measurements, but ambulatory-based blood pressure measurements and more diverse samples, so that we continue to build the evidence and to really perform very strong tests of the hypotheses to see the truth about if it's impacting blood pressure reduction. And then over time, if it has promise, at Brown we have a whole mindfulness teacher training program, particularly for mindfulness-based stress reduction that this program is grounded in. So there's opportunities to scale it up if there's interest there, but I'm trying to be cautious with it to make sure that we're being very data-driven as it moves forward. So.
And I imagine this approach must have global health benefits, not just with respect to hypertension. People must feel better through this program, I imagine.
Yeah, we have multiple papers under analysis, but we showed very nice reductions in depression symptoms, for example, along with improvements in stress. And so I think that is a piece, is looking at the whole person health.
Yes.
And so, yes, blood pressure was influenced by this, but if we're looking at overall cardiovascular health, or even more kind of whole person health in the global context, this has some potential benefit in that regard too.
Well, this is certainly a very exciting time as we're looking for new approaches to do better jobs in blood pressure reduction. So very good luck. And I certainly look forward to your phase 3 trial and certainly look forward to further discussion in this field. So all the very best. And thank you so much for your contributions to the scientific sessions.
You're welcome. Thank you very much. Yeah.